as mentioned, the exciting part comes now, I suppose, and that is the panel discussion. I said I don't have to introduce Feral because everybody knows her, but I still must. So Feral Haffajee is an author and a journalist and somebody who really provokes. And that is what is special about Feral, is the way that she provokes us to think about South Africa, think about our conditions, and think about things like the quality of life of South Africans. So thank you so much for agreeing to facilitate this panel, Feral. So appreciated. The panelists will include, I'm doing double duty tonight, myself. I didn't introduce myself, goodness. I'm the divisional executive of the Developmental, Capable and Ethical State of the Human Sciences Research Council, Professor Nanya Bola-Muller. And I was also one of the volume editors. Apologies for that, should have come at the very beginning. Then Professor Crane Sudin, who was the CEO of the HSRC, and we'll hear during the panel discussion, he was the one who gave birth to this trilogy of books that we see on the screen. And then we have Prof. Irma Elof, who wrote a very thought-provoking chapter in the book that she will be addressing during the panel. And Professor Letitia Brispel is also doing double duty tonight. And she will also be sitting on the panel. Feral will be guiding us, and then she will hand over to our acting Deputy CEO to wrap up the day. So I don't know if we have enough chairs up front for all the panel members and the facilitator, or if you're going to stand, I'll leave it to you, Feral. But if we could have the panel please come to the front.
Good evening, everybody, or good afternoon. So it's so delightful to be here with you. When Prof. Nanya asked me to come along and do this, I instantly dropped my ACDP and Al-Jamaa manifestos, which I was analyzing, because I'm tired of manifestos. I read the EFF one at 244 pages 3 times. So this is delightful to be here. Thank you for a beautiful keynote address, Professor Rispel. Lovely to be here with all of you. I must say that I found this edition refreshing and delightful. Prof. Sarah Motsetsa, please excuse me. Lovely to be with you in your home place. And why did I do so? Because I find our current debate enormously anemic and polarizing. If people are not burning flags, then you've got others of them #Abahambing. Or you've got people who are saying that social grants won't be paid to you if you vote us out of power. So it's been perhaps the most populist election campaign I've seen, and I've covered all of them. So to think a little more deeply about the state of the nation is truly delightful, and it's a great honor to be here with you. I hope we're going to have a nice, engaged discussion, and I'll start off with some questions about this very original look at the state of the nation. So I'll start with Crane and Nanya, the editors, and you can answer in whichever order. This is the 11th in the State of the Nation volumes, and it's a very wide-ranging and an ambitious look at quality of life and of well-being. I was happily surprised when you told me about it. It's the third of the themes that touch on the important themes of poverty, inequality, and unemployment, the 3 holy grails which we've chased for 30 years now. At the end of reading it, I found it a more relevant telescope through which to think about the state of the nation. Otherwise, you get lost in data and numbers, like I think the 30-year review published by the presidency recently does. So how did you come to it, and how did you fine-tune theory and scope? And either of you can kick us off.
Thank you very much, Muriel. And I'll go first. And so, first of all, just to say how really wonderful it is to be here with all of you. There's a great deal to be talking about there, but to get to the point quickly so that we can contextualize this properly, there are two reasons why this focus came about with this set of books. The first is that we chose the themes of poverty and inequality as our priorities to be focusing on at the HSRC. I mean, it was the HSRC's intent to try and angle as much of the work that we were doing around those kinds of questions. And just to give you a sense of how important that moment was, the very first Indaba of the organisation that I myself came to, we used this theme as the umbrella theme. And at that particular conference of only HSRC people, there was something like 200 presentations on poverty and inequality. You know, so it was really quite extraordinary. And it's out of that inside understanding that we thought that it would be really good to start reflecting what we do know about these questions. The second reason is that, and I come out of a long tradition. I'm an economics graduate, but I became a sociologist. And it was essentially out of frustration with economics. So this set of texts, these writings are an attempt to engage economics. So what we do here, and we'll talk a lot about this, what we do here is to acknowledge the centrality of economics in all of our lives. So material deprivation is absolutely always going to be visible and crucial in the texture and fabric of human experience, right? So it's always going to be important. And so we don't want to minimize the significance of that, but we want to get at the complexity of what that experience of poverty and inequality is all about. And so it's economic, but it's also social, and it's deeply psychological. You know, how the psychologies of inferiority, oppression, self-degradation work are really important things that we need to be understanding. And our concern was that a whole lot of the publications that were coming out in their focus on economics weren't getting to these other dimensions of what this is all about. So that's where this comes from.
Thank you very much, and it's good you felt that frustration, because it's led us in a different direction. Nania?
Yes, I was involved in when we developed our new theory of change at the HSRC and the decision to focus on poverty and inequality, and the astounding amount of perspectives that people have around these things. And we didn't want to let any of that go. You know, we wanted this kind of multidisciplinary approach, this transdisciplinary approach to be used. And so the books are the vehicles through which some of these messages are brought to you. And each volume is unique, but they also, when read together, I think fit very nicely because they come from different perspectives. The volume where I was the lead author, we looked at ethics and the ethics of care. And that is something that also flows through, I think, into this issue of well-being and quality of life, because we're not only considering GDP and numbers and Gini, and I'm not an economist, so these kinds of things really baffle me. But I am someone who's interested in equity and social justice, and I'm someone that's interested in unpacking these things and learning from others. So in the book we don't make any, we don't tell you what to think, I hope, in chapter 1, where we look at the various theories that there are around these issues. We don't want to be prescriptive in the way that one theorizes these issues. But we do put forward a few ideas to play with. And those are very important for us to familiarize ourselves with, so that we can become innovative going forward. And I like the idea of what we could do in future State of the Nations Prof. Risbel. But I just want to, I think, read this paragraph from the introduction of the book, which gives you an idea of how we don't want to be prescriptive and how we see this to some extent. It's on page, sorry, my eyes are terrible, page 16xv1, right at the top. So it says, the volume is distinctive because it will be the first text in the State of the Nation, and one of the first in South Africa, that is fully dedicated to a focus on quality of life and well-being. It offers a range of perspectives on quality of life that aim to reflect the complex interdependence involved in how people make lives for themselves and contribute to the lives of others. We argue that it is in this complex set of making lives, of individuals acting in their own interests, in the interests of others, of course, and the government articulating an agenda for the nation, that we are able to discern the outlines of the state in which this nation finds itself. And it's something worth thinking about, the outlines of the state in which this nation finds itself 30 years after the first elections.
Thank you very much. So on my travels around the country covering the election, I have to say that, so I enjoyed the book as well, is that there's no, you see, when I've especially been covering the EFF and trying to understand why MK Party has done as well as it has, you see that these are ordinary people who feel left out, looking in, and when you talk to them, it is really about the aspirations for lives of dignity, of being included. And I found so many answers in here, but I'll get to that a little later. Prof. Elif, I wanted to come to you and to tell us more about how you engage the concept of well-being equity, how you define it, and why you argue that it should receive the same attention as the more easily measurable poverty and vulnerability indexes, which in South Africa we haven't managed to mediate downwards, but which we are good at defining. Sorry.
Thank you very much for the opportunity to speak about this, because for me this whole book, and thank you Professor Risbel for pointing to the contradictions in the book, because I think this is such a beautiful part of it. With this particular chapter on well-being equity, what I tried to do was to connect two concepts, two dots if you may, that often remain separate from one another. We define well-being, we often, and quality of life, we define it in terms of economic indicators. But if you look at the underlying constructs of well-being, all of it are non-economic. It's about the quality of our relationships with one another, the quality of our engagement with the world, the meaning that we get from our lives, the big and small achievements that we have, and being a psychologist, of course, also the positive emotions that we experience on a daily basis. So, on the one side, we measure well-being and quality of life in terms of economic indicators, which is extremely important, specifically in a country such as ourselves. But on the other hand, we sit with these constructs that's completely non-materialistic and non-economical. So with this chapter, what I tried to interrogate a little bit was to see what happens when we bring this together. And it was interesting to take a look at what is going on globally when at the nation level we start to integrate the notion of well-being and quality of life at a more strategic level. And there's been some really interesting work being done in countries such as New Zealand and Canada and Scotland, where they start to measure well-being outcomes and then they integrate it into long-term strategic planning at the national level. So at first you start thinking, okay, but how's this going to work? But when you start digging down deeper into the statistical analysis of the economic indicators and the well-being indicators, it's actually quite astounding, the improvements in well-being at the individual level, but then also at the systemic level, because well-being in its essence is not an individual endeavor, it's a collective endeavor. And perhaps by bringing together these two concepts, we can deepen our understandings of both concepts, inequality and inequity, as well as well-being.
May I just stay with you for a moment? Have you given consideration to what our national state of well-being might be when you've considered how other countries define it?
Yeah. Well, there's so many levels on this because it's never static. That's the first challenge. What it is today may not be the same as what we have in June this year. So it's always shifting. There's also big differences between the individuals and the systems, and there's also differences in time. The good news for South Africa, though, is what's been shown in other countries is if we have a situation of high inequality, if you start investing in well-being, the gains are much more visible. It can be seen much more clearly than when you have a more equal society. So I think if you ask about what it means for South Africa, no, I cannot read. There's some studies on the well-being of children's well-being in the country. Shaisley Sabal at UWC does some excellent work on that. So there are studies that show that, but it's very much within particular populations. To speak broadly, I don't think we have a solid database yet, hopefully in the future.
Thank you very much. Prof. Rispel, you've spoken, you've highlighted the value of an academic and a practical focus on the quality of life and well-being. I've always liked that Gauteng produces an annual quality of life survey, and it's highly regarded. It tells us exactly where our province is. It'll give you a good measure of understanding why the election's likely to go where it's going. Do you think that we should be measuring quality of life at a national level more regularly, or is that a dream too far, given our very many competing priorities?
Thank you, Ferial. So maybe just to say that the Gauteng survey was conceived in a particular context. So, and I think it highlights the importance of leadership and an integrated approach. So at the time, and then I'll address your question about like a national measure. So at the time when the quality of life survey in Gauteng was conceptualized, it was really around the discussions of the Gauteng city region. And there were various economic initiatives, including Gauteng, the Gautrain, that were being planned, and and there was a strong feeling that the economic growth and sort of some of the initiatives, there had to be the flip side of the coin was a focus on quality of life and how these initiatives might actually link or impact on quality of life. So I think it was actually a very visionary initiative because it brings, as you know, the Gauteng City Region Observatory brings together funding from provincial government and contributions from Wits University and UJ, and as well as from the metros in fact, all the municipalities in the province, but mostly from the metros, to kind of continue to fund it on a longitudinal basis. But given this publication, I actually think such a measure, the HSRC already does the sort of social services attitude survey. And so I think it would be an opportunity to actually include in that social attitude survey some indicators on quality of life. There are instruments which I think could be adapted, sort of shorter versions, but I don't think it'll make, given that there's already investment in the survey, in doing the field work and sampling, I think it would be a wonderful opportunity if one of the kind of like outcomes of this volume could be that the HSRC actually takes the lead in the sort of measures on quality of life, which are broad and go beyond just economic, indicators.
And with all your experience, and I suppose this would be a slightly more popular or journalistic question, what would be your sense of our national quality of life and well-being? Is that a very big question?
So the short answer, Ferial, is that I think the similar, if you look at the triple burden, you would find that the markers of quality of life are gender, I'm not sure if I should say race, especially given that Crane is on my right side, because I know all the contestations around that notion, but let me put it in inverted commas, and geography. So I think you're going to see the similar fault lines if you look at quality of life in South Africa. That would be my short answer to your question.
Thank you very much. So Prof. Crane, if I can come to you, it is an election year, as we're feeling so intensely right now. And what are the social attitude surveys of the HSRC, which really, Ben and colleagues, are much deeper than any of the polls that have been coming at us left, right, and center? What are they showing us about democracy, democratic participation, satisfaction, well-being, and quality of life? And are there intersections across these things?
Nadia must answer.
Okay.
And I'm going to hand over to my SESAS colleagues to answer that question. We have some in the audience. I don't know if Ben is still here.
He is.
Yeah. Ben, would you like to make some comments about what Prof. Rispel has recommended and what Ferrell has mentioned now? Ben is a quality of life expert.
Yes, thanks. Sure, this is working. Yeah, there we go. Thanks for the opportunity to address the comments. I think the sort of survey infrastructure that HSRC has is indeed a good platform for examining different facets of quality of life. Actually, South Africa has one of the longest histories of research in a developing country on quality of life, going back to the late 1970s. And we've got more than 40 years of empirical research around this. The HSRC's surveys has actually taken over that initial research from the early 2010s onwards. So we are including measures of quality of life on aggregate, as well as domain-specific aspects of quality of life. I think there's always space for more, given the relative importance of this topic, and it's something that we're very keen to pursue. There's been a real burgeoning of scholarship in this space, and there's even a big meeting in South Africa in Irene, in Gauteng, in October. It's the local chapter of the International Society for Quality of Life Studies. So it's really going to be a big opportunity for the coming together of minds to really push the frontiers of our comparative understanding of this topic and identify priorities for the future. In terms of the governance angle and the electoral space, there is a chapter that we contributed to the volume that has really shown over time how a growing, let's call it a more critical evaluation of democratic performance is having an indelible effect on personal well-being. It is having a dampening effect. And that effect is getting more acute over time. So we can't divorce ourselves from context. And importantly, I think the optimism that South Africans are particularly known for is waning to the extent that increasingly we're seeing a more pessimistic than an optimistic outlook amongst the citizenry.
Thank you. That makes me quite sad. So one of the pieces of work I've been using a lot this year is the Indlulamiti scenarios work, because it's also really deep, really detailed. And they try to discern what is the word that best describes the South African mood at the moment. And contrary to the doomsayers who might say that there's insurrectionary radicalism setting in, not at all. The word was disappointed. Isn't that interesting? Because it tells you of how much hope there was, that it's sadness, hopelessness, and disappointment coming through there quite a bit. So Crane, if I could come to you then, the work of Amartya Sen, whom I've always admired for opening up our thinking so much on human development and development as freedom, I was happy to find is woven through the volume. So how was his work useful, and then also how was Martha Nussbaum's work brought into that to widen your lens even further?
So Amartya Sen is all over this book.
Yes.
In many, many different kinds of ways. So we genuflect to Amartya Sen, but we're also critical of elements of it. And that's entirely appropriate. But the big thing about Amartya Sen is shifting away from what he calls these aggregates. And so it's these categories, Letitia, that what these categories do in sociology, in economics, is actually do the thinking work for you. Once you've got a category, that category is going to do the explanation of what the problems, the issues are. What that loses is the density of actually what's going on. And it's what's going on that Amartya Sen says is really important. Try and get into the minds of people and how people come to construct the ways in which they make sense of the worlds in which they find themselves is absolutely important. So, and it's a drift in a whole lot of the sciences, right now. So we're seeing it in the social sciences, but it's also, of course, very deep and important for thinking about the hard sciences. So medicine, for example, is going in this direction. It's thinking about people, not people as individuals in their social contexts. Not people as these labels come to, in a sense, present and project them. What the labels do is already bring you a sociology which is already predefined, already in some ways boundaried, and already full of its explanatory power. And what Amartya Sen does, and it's deeply decolonial, I want to say. It's decolonial. He doesn't ever, of course, use those terms. It didn't occur to him. But he's doing decolonial work here. He's trying to take the way in which we come to understand everyday life right down to its contextualized realities. And so to explain things as people are seeing them, it's what people are thinking for themselves about the spaces in which they find themselves. And of course that thinking is contradictory. It's deeply contradictory. And there's a wonderful chapter in here by Justine Burns. She's an economist, a hard economist. She uses numbers, and she's trained with numbers, you know. But she's become what she calls a behavioral scientist. And she's interested now in behavior and choice. And the ethical point at which she's arrived in her work is how much should we be engaging with ordinary people about the choices they make? You know, should we be more interfering? Because people, as she describes it, make automatic choices. They kind of instinctively sum up circumstances and situations in which they find themselves. And what they're drawing on are funds of knowledge which come out of their experience, which are often wrong. You have to say that. You know, it's not an...
Aren't they more often right?
Well, they're both right and wrong. They are both right and wrong, you know, but I'm talking about what it is when they do things wrong. Like when 16-year-olds decide that the best thing to do is to get drunk, right? I mean, how do you begin to interfere with that? How do you begin to say, you know, what a better choice, a better set of choices, you know, might be when there's information which tells you that you're going down a wrong track here. So, I mean, this is where this Amartya Sen stuff is deeply, deeply stimulating, provocative. It leads you into spaces around ethics, around making sense, and particularly around capacity. And his big point is helping all of us to be more capacitated in the way in which we make decisions. So when we come to make or come to confront any problems in life, what resources are we going to be bringing to be able to deal with those problems? So it's asking us to respect where people are, but it's also raising these questions of how you then deal with some of the wrong things that are in people's heads.
Thank you very much. So, Prof. Irma Elof is a professor of educational psychology at the University of Pretoria. We didn't introduce you well enough, so we just wanted to do that. If I could ask you to continue to expand on the use of Amartya Sen, and also give us some consideration of the mental health of the nation and why that is a consideration that should be right front and center in your view.
Well, first I must say, when I became a psychologist in the middle 1990s, it was just unthinkable for any psychologist to be a part of discussions like this. Even.
Why?
It was when a psychologist would mention things like well-being or all of that, people would roll their eyes until the serious people started to talk. And I think we should, I think we should give acknowledgement to the fact that we have it in this State of the Nation publication, and we also have it as part of the national discourse, and we have it globally. So for me, as a psychologist, I'm very thankful for that work, because I don't think it's a given, and it wasn't, I don't think it's, it would have happened, necessarily. So your question is about mental health. I have extreme worries about the state of mental health. And we need to distinguish between mental health and well-being. Well-being is, in general, how you are as a human being, how are you doing. Mental health in itself is in the same realm as what we would look at in terms of medical challenges, in terms of mental health problems. And I think we're at a serious point in this country's history, and I think it is completely under-acknowledged how severe the mental health challenges are, specifically with our youth. I work in a university context. I am very worried about the mental health of our young people. They are being inundated with all sorts of external stimuli and challenges, and we are not equipping them to the extent that we can, and we are completely under-resourced in the mental health domain in the country. So I don't usually like to be alarmist, but in this instance, I'm very worried about that.
Thank you. Thank you so much for that. Please, Letitia.
But I just want to add that I agree with you, but at the same time, it's not just external stimuli. Some of the stresses are real.
Yes.
So I have two cohorts of WITS health professional graduates. The one was established in 2017. We've been following them up. This will be the 7th year follow-up, which is a very novel study. And the other one, we established a cohort last year. And when we ask a series of questions on mental health, and the stresses are real. It's around, especially for, Crane, one of the things we developed was we developed a very interesting socioeconomic index, which took account of like parental education, whether they own their assets, which we measured in terms of things like accommodation, owning a car, a smartphone. Well, smartphone wasn't that helpful because everybody has a smartphone, which is good, I think. And, whether they were born in a rural area where they completed schooling, primary and secondary schooling. So very comprehensive. Of course, it's our own index, but going beyond categorization. But one of the things we found, Ferial, is that 4 of the 8 groups that are currently trained in the faculty are of the sort of lower quintiles, high dependence on NSFAS funding. And when we looked at the relationship between their self-reported mental health status, we found that some of the stresses were related to academic workload, which is always bad for health professional students more than other groups because they do, for a whole range of reasons, it is much harder. But finances came up as a big issue, being stressed about, financial security at the university. So I just want to make the point that some of these stresses are real, things, and it highlights the kind of the financial burden, which of course became a big issue in 2015 and 2016 with the Fees Must Fall protest. So it's not just in isolation. And maybe just the last point, that sort of nationally, when we look at some of the projections worldwide, by 2030, mental health conditions will be the number one, contribute to the number one burden of disease. And of course, we have the opportunity now to do something about it.
I'm glad we're talking about it, and it's not the hidden, like you say, you couldn't some years ago. So, Nania, climate change is covered often under the rubric of energy or weather or carbon trades or science, and I was interested to find it here in a volume on well-being and quality of life, probably because it's so front and center in our lives, and how you play with the concept of just breathing. Could you share with us some of your thoughts there?
Sure. So the issue around just breathing is, are we just surviving, or are we breathing within the space of justice? And here we talk about climate justice and the environment. And obviously, if you are not living in a space where there is clean water and clean air, your health is affected, literally. And the Vaal Triangle is one of the most polluted areas in the world. And that boils down to coal. And brings us to renewable energy. So there's a lot that comes together, because in Section 24 of the Constitution, it's one of the early places where the word well-being is used, to protect the environment, for the well-being of people, but in a sense also for the well-being of the environment itself. because we're connected as humanity to the earth that we live on. And so that sense of being a part of something bigger than yourself could possibly lead to a better sense of self and quality of life. And that's why I also really like Martha Nussbaum's work. She took it further than Sen. She worked with the Amartya Sen, but then she took a sort of a more feminist perspective on it and grounded things in storytelling, in narrative, in concepts of safe spaces. And so, some of the international ideas around well-being is to provide green spaces in cities. And people think that that's not really important. It's exceptionally important for well-being, for people to sit in a space where they can breathe freely and they can experience the grass, the trees. I mean, it sounds silly, but it's not. It's a lot of what we experience when we go to the seaside and we breathe in the fresh air. So, there's a lot of this in Nussbaum's work. She recognizes material well-being as an issue because she, in her book, Women and Human Development, she actually went to India to work with women in the informal settlement and to find out how they lived and whether they were only surviving or whether they had ways of tapping into other things that make their lives worthwhile, without ignoring the fact that we need to put food on the table in order to survive. But the whole breathing thing is really, it's the essence of life. And so we thought that we would bring that environmental and climate change issue to the fore by looking at literally how it affects us physically.
Okay, that's really interesting. Just a small story. 2 elections ago, I asked the then mayor of Johannesburg, Park Stow, to take me on what he thought was his most important deliverables of his terms. And he took me to parks, which, I suppose parks. But he took me to parks because that was the thing he was proudest of. Mostly in Soweto, but also in the other townships of Gauteng. And that, when I think about it now, it's quite saddening that now we're in a mode of just protecting basic infrastructure, towards fixing the water infrastructure, towards making sure that the rollback of electrification is not so severe that it becomes a massive democratic deficit. We were doing good at those things, and now we kind of roll back. I'm going to open up for questions now and then go to a final round from our panelists in a bit. Comments, questions, thoughts on the state of the nation. I look forward to them. Anybody? No?
Thanks, Ferio. And thank you to the panelists and the keynote address. My name is Kugan Pillai. I'm a governance and human rights advocate. Certainly you've been shooting above my comprehension level on health policy.
Really?
But the question I want to ask is, how do you translate this to what the president is putting into effect tomorrow? Okay. How does this feed into that? Given what you've just presented, is there, we talk about evidence-based policy. Will this be addressing the key challenges that we are having in health? Thank you.
Thank you very much. So I think we've all read by now that the president at 2 o'clock tomorrow is going to sign the NHI bill into force. Would anybody like to comment on that? How it might lead to improved levels of quality and well-being? Why are people so worried and anxious? It has the opposite impact that such an announcement might have had.
So, Kuben, let me try and be brief. When you just look at broad indicators, so for example, South Africa as a country, we spend over 8% of our gross domestic product on health. And half of that, roughly half of that, is spent in the private sector, which provides care to, on average, around between 16 and 17% of the population. Now, of course, there are differences. In the urban provinces, like Gauteng, you find that a quarter of people in Gauteng are on private health insurance or medical aid schemes. Similar in the Western Cape and probably KwaZulu-Natal. But that figure, if you look at the Northern Cape, it's only around, I think it's less than 10%. I'm speaking under correction, so don't quote me on the exact figures. So the challenge is that there are huge inequities between the public and the private health sector, almost in all respects. The NHI is very much a financing reform. So it's an attempt to actually address the inequity in financing of healthcare. And I think we often, part of the problem is that the discourse has become very polarized in that we don't really look at some of the complexities. But so maybe the first point to say that it's a financing reform. It doesn't really deal with some, and of course with any financing reform, there would be a whole lot of other things that need to happen almost simultaneously to address your key question on, on a different experiences. So it's a step, it's an important step towards achieving certainly a more humane and dignified experience for many people in public health facilities. But I think we also need to recognize that what tends to get into the kind of like the news and the media is that you don't see the sort of very dedicated healthcare providers and the positive experiences in the public health sector. We tend to overlook those positive experiences because it's absolutely dreadful when a woman dies in childbirth because of neglect. And so, there's no way to condone that kind of very human experience. Or when an old person, not an old person, let me say when an elderly person doesn't receive, respectful and dignified care, there's no excuse for that. But the NHI is only one step in actually beginning to address some of these deficiencies in healthcare. It is not a panacea. There are other things that need to happen in tandem. So when the bill is signed tomorrow into law, practically very little is going to change for the certainly. I know that some politicians have promised that once the bill is signed, immediately you're going to have access to a private health facility. It's simply not going to happen, because some of the details still have to be worked out. So I think if we begin to see it as a stepping stone towards getting us eventually to that end goal that's been promised, initially in the RDP policy document, but certainly in our constitution, then I think if you begin to see it as beginning to kind of one of the pieces in a puzzle, in a very complex puzzle, then I know it probably doesn't address your question, but then I think it makes it easier. So it's a financing reform, and it should be seen as a financing reform. It's not going to it's just one step in kind of trying to deal with a very complex healthcare system that we have.
Thank you very much. I know you don't want to speak about NHI too much, but that the most cogent explanation I've heard today, and there's been a lot of heat. Thank you very much for that. Any other questions from our audience? I'm sure there are. Yes, sir. Welcome.
Thank you. So my name is Kwena Khabi. I'm from University of Pretoria Research Office. So coming here, I was reading an article, though I was a bit late, and I noticed the unemployment rate has just increased.
Yes.
As a breaking news. So my question then would be, which I have it here to say, what do you say is the linkage between the current level of youth unemployment and the quality of life in South Africa?
Thank you so much. Great question. Anybody want to take that now?
That's a complex question. Obviously, being unemployed is going to affect your sense of well-being and your quality of life. So there's a direct relationship between those things, but we could also see distrust and despondency as something that affects people's mindset in going out there either to seek employment but also to make employment. South Africans are not very proactive when it comes to entrepreneurship and those kinds of things. In India, it's mushrooming all over the place. Young people are just doing everything, startups everywhere. But there seems to be a different mentality, one of less distrust and more hope. But South African youth, and we heard about the mental health issues, seem to be despondent to the point of giving up. So there might even be jobs out there, but we have this scenario where SASAS has done the research. South African sense of hope has gone down drastically since 1994. And I think, especially with the youth recently. So there's a lot of factors that come into this growth, the growth of unemployment, and some of them might actually be related to the sense of distrust and despondency that we see as the state of the nation and the state of the youth. I hope I'm making sense.
Thank you. Yes, ma'am.
Good afternoon. Thank you so much. I'm Deboho from ASAF. I just wanted to touch on the question about mental health. I know Prof gave a response, but I think it was based on academic setting. But there seems to be an increase in general of mental health. What could be the underlying issues with that? Thank you.
Prof. Ella?
It's always very difficult to answer a question on underlying issues without being a reductionist. But let me just throw out a few things out there. I think we can do much better in terms of mental health and also health literacy in the school curricula in the country. It's often a neglected thing. Other things are more highly prioritized. But I think if we can invest in that, we may get somewhere. I also think in terms of the resources that's available, and I'm not someone who say you have to have the resources in order to address the challenge, but just if you look at the percentage of psychologists, care workers, counsellors, towards the ratio towards the general population, it's impossible to serve the population as we are. We are prioritizing the training of other health professionals as we should, but we are definitely neglecting the training of psychologists and counsellors in this field. So in terms of contributing factors, I think a well-developed support structure underneath it all, coupled with real straight-up education on mental health literacy, can get us somewhere.
What about innovations like, I think it's the gogo benches, the grandmother's benches from Zimbabwe? Are we doing things like that? Do you just want to explain it for people who may not know? Huh?
That's the beauty of mental health challenges. You can do very little and have a huge effect, like projects like that. The grandmother benches and sitting together, of literacy projects, of adult literacy with adults teaching others. There's so many things that we can do, and it need not be highly resourced or very expensive for that matter. It just needs someone to push for it.
Thank you very much. Any other questions? Yeah, I have a few more before we wind up. So I do want to go back to Amartya Sen and the theories of capabilities and just try and bring it home. So I'm noticing in my travels through all the manifestos that there's a real populism laced through lots of them. So most, other than for the EFF, are wildly anti-migrant. They go from, okay, not all wildly. The ANC's is there. The DA also says job reservations for only for South Africans, all the way to the Patriotic Alliance, which is on the other extreme. So that's definitely a growing trend. The other one, which surprisingly has come up again and again and again, and I don't know about your audiences, but certainly at the Daily Maverick, people love it, is bring back the death penalty. Several want to revisit our consensus on reproductive rights and on LGBTQ, TIQ rights, queer rights, all of these things. So what you see is a growing conservatism in the body politic, and at the same time a rising populism. It's also the most male election I've ever covered, where you only have one woman leader of a party likely to get in, and that's Pat Dillal. The candidate numbers may be different, but this is an election being narrated by the male voice and by quite patriarchal politics. So the only progressive consensus I'm seeing is the general view that we need a universal basic income. I'm not talking about basic income grant, a universal basic income as the right of South Africans as a way of countering unemployment. Within the context of quality of life and well-being and Amartya Sen's theories, is this a good plan? Crane, do you want to consider that? Like giving people the money to do their own thing.
Well, the problem takes acute expression here in South Africa, but it's a global problem. And particularly just the way in which economies are structured. I mean, they're structured towards specialization, niche, kind of concentration, and so it's very difficult to have high levels of employment in countries which are not, for example, investing in capabilities. And the kinds of capabilities that matter. But not all countries are rich. And so you have, in a country like ours, people with a whole range of situations. And you've got to confront the reality that going into the future, people will need support. Whether you like it or not, people will need support. So you now need to be building economies which can generate enough income at a very high level to be able to support people who don't easily get absorbed into these systems. And that's a reality I think it's staring us in the face here. We are doing something about it. South Africa is almost unique in the world in relation to the levels of welfare support that we provide. It's not great, but there are very few countries that are doing what we do. We need to do more of that. But it also needs to come alongside of this capabilities thing, giving people the capacity to be able to think about, and this is where this behavioral economics is crucial. What do I do with this money? right? How do I begin to work with this money? And there are extraordinary stories where people with this little bit of money are actually saving. You know, they're managing to go into context and to, with just a little, do a lot in their lives. And so that kind of financial literacy, that kind of intuitive sense of, you know, how to hustle in a space like this is not something that comes easily, but we need to be, encouraging it. The way in which we're encouraging it right now is through antisocial behavior, through these kind of gang cultures. And gang cultures are an easy way of bringing people into levels of inventiveness. People are incredibly inventive as people working in antisocial kinds of spaces. You want to kind of think, how can you make that stuff more pro-social? You know, all of that inventiveness, how can you turn it? And it needs intervention. And I don't think we know how to intervene, in this. So policing is a big issue. Some people here have written about policing, and we don't not want policing. We want policing, but we also want welfare support, which is going to come with thinking about wholeness, about how communities develop a sense of cohesion, intergenerational, if you like, trust. So the whole range of factors that need to be deliberately instituted into the way in which we manage, our society. And I'm really disappointed, I want to say, with the religious institutions in our country.
Why? I think they're marvelous.
Well, they're not doing enough. They are not, religious institutions are the largest, if you like, social organizations in the country. And some of them are beginning to think about instituting in those congregations ways by which to produce support. But you think of a whole lot of churches that are mushrooming and are growing around, and I want to say, antisocial behavior. All of this thing about demanding money from people, with instant cures and miracles and so on, is antisocial. It's a better form of gangsterism, slightly better, it doesn't come with the harms that come with gangsterism, but it's in that same range of responses. And we need to find better ways of coming to think about how we, privileged people here, our organizations, and particularly religious institutions, think about poverty and inequality. How do these churches, mosques, temples begin to think about intervening and engaging with these people whom they see every Sunday? And so I'm going to get into trouble here. But let me say, to think about their salvation here on earth and how to make it,
I thought they did quite a good job during COVID, actually.
It didn't last, eh? Let me just talk about that. So in COVID, we saw the best of the country. We saw incredible organizational developments. Solidarity. So I was partly involved with the Community Action Network structures in Cape Town, and I can tell you, you never saw a level of inter-community, intergenerational, interclass, across so-called these racialized divides and so on, the ways in which people came together and cooperated. But those structures were deliberately dismantled by local government. Local government came into all the CANs that I was kind of associated with, had an association with in Cape Town, were dismantled. The politicians said, we will do it. And of course they didn't do it. And so, all of that good experience has evaporated. And, we really need to find ways of thinking about how that experience can come to teach us, ways of moving into these spaces of utter desperation now that, we're seeing all around us.
The other example from that time, a little bit more macro, was the Solidarity Fund, capitalized, constituted outside of the state to avoid the corruption that we'd been seeing, and you buy vaccines and distribute it through that. I do think that's a model to begin to consider. Let's go for a final round now, and I see if you want to play with me a little bit. So say you're in a new cabinet. No, I won't ask that question. But what I do... what I'm seeing is that we're going to have a highly complex political environment come May 30-31. We might have different coalition governments at provincial level, different ones at a national level, sometimes of the same parties. 7 of 9 provinces or 5 of 9 are probably up for new governments. So massive changes coming everywhere. 15 days in which to form these governments. Prof. Rispel, how do we keep these very important ideas of quality of life, of well-being, like you said at the beginning, important that in the next phase we begin to draw the intersectionalities together, begin to consider questions of dignity in these questions of well-being. What do you think the priority should be in such an environment?
That's a very difficult question, Ferial, but I think one of the, as Crane was talking, I was thinking that one of the, and they highlight it in the volume, that one of the limits of Sen is that he sort of there's insufficient recognition of the importance of individual agency in his theory. He, as you were talking, Crane, I was thinking that I've been saying to people that one of the things that I think is going to get us out of this a tricky situation and the wicked problems that we're facing is the sort of old-style, almost street committees and ordinary citizens, ordinary people taking, like emerging. For lack of a better word, Feral, if I can call it people's power, and we're beginning to see that. I'm in Ward 118 in the city of Joburg. And we have a group there, a combined group that stretches quite sort of diverse socioeconomic profile that actually emerged after the floods in 2022. When people did a detailed analysis, they found that one of the problem of the damage that was caused to homes was that dumping of rubbish actually blocked stormwater drains. I think you might know about the KIC initiative. And so what is emerged is actually an amazing bottom-up community initiative, that continues to grow. And it's around educating people. It's around turning some of the dumping hotspots into communal gardens, both for food, but also for, for just kind of beautifying the area. The area is a whole lot cleaner. And I think we're beginning to see that when people take power in their own hands and hold government officials accountable, my sense is that the politicians will be scared and will think that we might be able to do without them, but what the KIC initiative does is that it's also a partnership with people from the city, relevant officials in the city. So let me come to your question about priorities. One of the key priorities, I think, is that we have to find a way of infusing these. We have to strengthen the civil service. Because we often talk about politicians, but if we have continuity, stability, a capable civil service, then I think half of our problems will actually be solved. Because politicians come and go, they generally focus on the small, on the short-term initiatives, whereas we would want to have a capable group of civil servants that would be able to take forward some of these, these initiatives. So I think for me would be around, I would certainly wouldn't want to see the instability in leadership that we're seeing at the local government level, particularly in the city of Johannesburg.
6 mayors in? 6 mayors in 4 years we've had about
yes. And so, so what would be great if we could come up with a clear set of rules of engagement around coalitions and how they function. It's around, and the second big priority for me would be about putting us in South Africa at the center of any initiatives, rather than the other way around. So those would be for me kind of, stability of leadership, recognizing the importance of a capable civil service and doing everything to, to protect that. And the third thing would be to put us as the citizens at the core or the center of any development or any initiative, rather than, those who are in power.
Thank you very much. And harness that people's power, which I think all of us are seeing. It's the resilience, that's what's keeping our country going. So, Prof. Elo, not that we want to increase the size of cabinet, because we already have, 36 ministers and 39 deputies? I don't know, it's a lot. Do we need a minister of happiness, or do we need to measure gross national happiness? Or how do we take forward your idea of well-being, equity being placed at the center of how we think about things?
Yeah, well, that's an interesting idea. First, to answer no, I don't think so. But we can take some courage from the fact, we all know the example of Bhutan, who's done they designed their whole planning around well-being and happiness. I don't necessarily think we need a whole ministry, but I do think we need more alignment in terms of the discussions that's going on around well-being and quality of life, and our policy alignments in all the different ministries that we already have, starting from education, starting from health, social development, all of them. I think if we do more work in aligning that, it may actually get us somewhere. It may get us even further if we start aligning budgets and prioritizing certain domains of well-being that we know will be able to act as levers to improve well-being. If we have that boiling all the way down to budgets, then we may see some movement. But that can be done by all of us together. It need not necessarily be done by a minister. Getting back to well-being, well-being is relational. It's when we turn to each other. And I think that's one of the... You ask about South Africa. I think we are at our best when we are at our worst. We turn to one another and we build those bridges, and people get together to find extremely resourceful solutions to the challenges we face.
We do, hey? July riots, COVID, does bring out the best in us. Prof. Nania, I'm going to come to you and then go to Crane now. So you've been studying coalitions. How do coalitions intersect with a capable state? How do you make them intersect, rather?
Yes, well, we're a country that's seen coalitions succeed and fail at local government level, and when they fail epically. We need to take a look at which coalitions have succeeded and which haven't, and maybe learn lessons from those local government coalitions that have succeeded. What's important is transparency. In the Scandinavian countries, where 90% of the population are in favor of coalitions, there are coalition charters that are entered into prior to the elections or directly after the elections. There's planning, there's bringing people along with them. It's a lot about just being people-centered, even in a situation like this, where the voters voted for one party and now they're getting something else. So people need to know this something else is going to improve service delivery. This is the big thing that people want. They say, okay, we're all right with coalition governments, but they must improve service delivery. And if they don't improve service delivery, we don't know what to expect.
Some data you showed me suggests people are, they don't have big trust levels in coalitions. Eh?
Well, they actually have more trust than is expected, but it's dropped from 2014 until 2023. 39% of the population was okay with coalitions, dropped now to 30%. But at the same time, people are saying, if necessary, if we do need coalitions, if they deliver services, if they make our lives, delivery of services about making lives better, it's about quality of life, then we'll accept it. And South Africans are very much that way. You know, we're not that insurrectionist.
No, we're not.
We're accepting as a country. We really are. But what I want to say about all of this is that everything about quality of life, everything about well-being, dignity, equity, equality, freedom, choice is in the Constitution. And the constitutional values and the Bill of Rights should guide us in the decisions that we make, which should guide government in the decisions that it makes. And it often doesn't.
Quite right. Tell you about a moment last Friday when MK was at the Constitutional Court fighting for the right for its leader, maybe, or not leader, given how they're fighting, the former President Jacob Zuma to be on the candidates list. I was really struck by that moment because if you read the MK manifesto, it wants to do away with the Constitution by referendum, but yet claiming all the rights of it. I've also seen quite a few manifestos which either want to limit parts of the Constitution or have referendums on its basic rights. So you remind us very well that it's all in there. Huh? So finally, Prof. Crane, say, the new president is inaugurated and he makes you his advisor. What would you whisper in his ear?
Well, it is about giving people a sense of dignity. You know, I mean, that for me is the most critical thing about being human. You know, having a sense of how my life as an individual and as a member of a community, how my life counts. And finding ways to help us. And this is why Senya is really important. Because he's saying that we count in different ways. You know, we come to a sense of our humanness in very different ways. And you need to recognize that. I don't want to be treated as a category. You know, don't put me in a category and begin to pronounce policies and think that, you know, you're going to be dealing with the specificities of my life. Now, it's difficult, of course, to be specific about 60 million people, you know, but you do need to understand how some of us come into this kind of space in thinking about our happiness in ways in which I think our policy at the moment is written according to scripts which largely come out of the experience of Western Europe, and those scripts don't understand us. You know, they don't understand the complexity of who we are. So we do need to think about according dignity in very much more imaginative ways. Now, I don't know what they are, you know, but talk with us about it. I mean, the thing that didn't happen after 1994 is that the government didn't go to the people and actually engaged with the people about what the people wanted. It happened in Cuba. When the revolution happened in Cuba, things were shut off for a year as the politicians went and consulted with communities about what they desired. Now, you're not going to be able to, of course, fulfill everybody's desires, but you have a sense, of where you need to be going. So in this rushed lives in which we are leading, we need to be pausing a little more and come to deal with the complexity. And if what people are wanting is not possible, we need to talk about it. So if it's not possible to give every single person a house in the country, we must talk about it rather, instead of just keeping silent. So we've got to find ways of dealing with where people are. And I'd say that. Send your party to people's houses right now.
Yes, go to it. House visits. So just finally, I've been following the EFF a lot, and Daily Maverick readers are getting very cross with me for doing that. But I saw a beautiful lesson in why I think Julius Malema is such a skilled politician. In Kutsong the other weekend, the applause he got, the biggest applause, was not for nationalization of the banks or the mines or prescribed assets, but it was for this promise. It goes something like this. I won't do my Juju voice. So he says, we're going to do RGP houses, but they're going to have 3 bedrooms, a nice dining room, and a toilet in the house. It's the kind of house where you must phone your friend and say, yeah, come over to my place. And the crowd went mad. And I thought that was like such a simple indicator of why he's a good politician, firstly, but of a very basic hunger for the goods of dignity, the life of what makes a dignified life of promise for people. So please join me in thanking our fabulous panel. Yes, sir. You had a question? So sorry. You had a last question?
Thank you very much. My name is Itumeleng Khasitsiwi, and I'm from the HSLC. I would like to kindly ask this question before we close.
Sure.
Does the book, State of the Nation, Quality of Life and Well-Being, and the contributing authors look at the direct link and role that structured and institutional racism play in affecting, whether positively or negatively, the quality of life and well-being of people in South Africa?
Thank you very much.
Thank you.
Any of the authors like to take that?
We look at everything in the book. Race is a very important part of it. So is gender. We have taken an intersectional approach. But of course, each author of each chapter has their own way of a lens of looking at things. But we certainly can't ignore any of these intersectionalities, and we cannot ignore race.